Hello, Monique. This is Belen. I hope you're doing well and that you're enjoying the class so far. I wanted to interact with your post. I found um, your assessment to be very interesting to me, and you picked the SUDDS 4 assessment. And this instrument specifically focuses on alcohol and drug dependency. I have never heard of this assessment before until this week that we started reading it, and I'm glad that you chose it. I I did understand that from your post, I understood that this assessment it takes 30 to 45 minutes to complete, and that it is done in a computer or like a tablet, or so it's like an electronic form of taking an assessment. Um, One of the strengths that I noticed is that I think sometimes as clinicians, when we're assessing for these things, if we have not been able to build rapport with our clients, or our clients just don't deem us trustworthy for whatever reason, um, they may be hesitant to report some of their use or some of their symptoms. And I think that having to do it in electronic um, like tool may diminish their experience of feeling judged, right? And may be more willing to disclose information because there's not like a person attached to the reception or retrieval of the information, right? Maybe there's enough distance from the provider to where they're able to feel safer and more willing to disclose. Well, that's one of the strengths that I noticed from this assessment specifically. Um, and from some of the weaknesses of the assessment, you brought up something that is so important. You talked about literacy, right? Like, what is our ability to read, to utilize an electronic device to take an assessment? Do we know what we're reading? Do we comprehend what we're reading, right? And so that's a big barrier. And I wanted to add to that, in addition to that, what I noticed to be a barrier is also the length of the assessment. And so for someone to sit and take an assessment to 30 to 45 minutes, that seems very extensive to me, to be answering questions, especially if you think about somebody who may have alcohol or drug dependency. I think that this would be a very stressful assessment to take. I think that there may not be enough distress tolerance to go through the test. It might be an extremely uncomfortable assessment to have to sit through, to have to read for that long and to have to answer for that long. And maybe if we can add to that, if the person is having some kind of physiological symptoms of withdrawal, um, and that can be just a very uncomfortable experience. So I think that while the assessment might be extremely thorough and helpful in capturing the information that we'll need, it may also be like a little bit too distressful for individuals to take it. Um, but yeah, thank you so much for highlighting this specific assessment. I never heard of it before, and I find it very interesting. I think maybe in certain settings, like more clinical settings or inpatient settings, or in a setting where maybe someone can be medicated prior to release some of the discomfort, then this would be a great assessment, because I can imagine all the data that is capturing, right? And to have someone who's trained to be able to interpret the data within 5 minutes, that really takes a lot of the work out of it. The system is really kind of conceptualizing all the information for us.